experience using Wolbachia to control dengue transmissions. And the last subject is EDB Jogja Entomological Studies, current update. The first would be presented by Professor Supratman Sukowati, and then by Dr. Frutos, the second, and then the third speaker will be Dr. Peter Ryans, and then the last, but not least, will be Dr. Warsito Tantowijoyo. Before we start, I would like to invite, but apparently not enough chair over here. I would like to invite all speakers to come to the stage. Could you please give me one more chair, please? Yes, please.
Because I'm the first, you're the second.
I'm the third, I think.
You're second. Okay. Yeah, take a break.
Let me first introduce Prof. Supratman. Prof. Supratman is a professor in biology. He's now a senior researcher in National Institute of Health, Research and Development, Minister of Health. And also is member of scientific committee in Indonesian Institute of Science, or LIPI, Minister of Research and Technology, and also National Institute of Health, Research and Development, and also member of National and Regional Malaria Working Group and the DHF Working Group. So please, Prof. Ratman.
Thank you very much, Mr. Chairman. Okay. Thank you very much, Mr. Chairman, and I would like to thanks to the committee and all of you. Without you here, I'm nothing. Well, I have a class is very easy one for talk about the dengue vector control program in Indonesia. Actually, I just summarize what's going on about the control of vector dengue in Indonesia. So we have quite problems still in this vector-borne diseases. You know, we have 5 main vector-borne diseases: dengue, malaria, lymphatic filariasis, Japanese encephalitis, and chikungunya, which 4 of them, you know, always occur in these urban and suburban areas. But you know, the fourth one, Japanese encephalitis, that only in some areas like Bali, Sumatra Utara, and East Nusa Tenggara. Well, I just to remind you that Indonesia is the second biggest, you know, cases in the world. So the first one, Brazil. But anyway, we still have to work hard about how to solve the dengue problem in Indonesia. So this kind of endemicity in Indonesia, you know, even in Jakarta, West Java, and Banten. Then you have also in Yogyakarta. This is more than 50, you know, incident rate. Yeah, and most of the Borneo, except the, you know, South Borneo, so right, and here in West Papua and South Sulawesi, not Sulawesi, I mean, yeah, it's quite high still. And our problem nowadays is how to tackle dengue. Should be we have to cut here until under 20, but still high. Of course, the trend, you know, just fluctuate, and the cases and the case fatality rate always coming down, but still higher in Southeast Asia region. So this is our main problem. So you can see here the dengue, you know, cases in Indonesia. Of course, this in 2012 we have little bit decline, but in 2013 I have data, but I could not see in my presentation. But actually a little bit high now. This little bit climbing. Well, this is the problem. So I will go first about the problem of dengue. This is the incident of dengue hemorrhagic fever. So our target, this is our target, that still our target is still high, in Indonesia. Until 2014, incident rate should be under 51. This is our target. But now in 2012, we have target, under target our incident rates. But the problem is this target higher than at the Southeast Asian region. But case fatality rate, that monthly incident rate, you can see, but case fatality rate in some areas is high than 0.1. 0.1 should be 0.1, yeah. This case fatality rate, our target. Yes. Then this is in Jakarta. In Jakarta, you can see that, quite, worried about, because Jakarta is the capital city of Indonesia, but dengue is still our problem. Although nowadays in Jakarta we have regulation already, started in 2008. That's our regulation in Jakarta. If we have found any single larvae in houses, and inspect by our, we call Jumantik. Jumantik is the inspector, volunteer inspector, which inspect each houses, and this Jumantik paid by the government, but it's not so easy to enter the house. The problem, not like in Singapore. The civil worker can enter and give the punishment to the houses which find the larva. But in Jakarta it's not so easy. Why in Jakarta still high cases and fluctuate the cases in Jakarta? And what this I just play around the real correlation between the dengue cases and rain. The frequency and rain and the number of rain. So, have the correlation if the rain coming up around 6 to 10 weeks before the peak of dengue. So, our calculation, the correlation is quite nice. Yeah, you have the correlation positively. Yeah, have the correlation. Of course. In some areas not, but this is only in Jakarta, not all over. Because when we analyze, probably in Jakarta there are different pattern, the correlation between the cases and rain. So, what's our objective now? Of course, the first objective, we are going to follow the global commitment, MDGs. We have to control these transmitted diseases. In 2015 should be, our cases should be only 50%. It decreased 50% compared to 2010. But dengue and malaria, I doubt it to have this MDGs standard. But TB also, it also is not so easy to catch the MDGs. But we try hard, Professor Hal said, we try hard to reduce, become 50% of cases until 2015. But now almost 2015. But the cases not coming down, but coming up. Yeah. I don't know. It's not so easy, so that issue in this vector-borne diseases in Indonesia, and this is not only dengue, the first MDG, post-MDGs, and this become neglected diseases, where is Mrs. Rita, and the burden of diseases, and we are also calculating the burden of diseases, and then the problem of the emerging and seasonally now become more complicated due to the CC, climate change, and also the physical environment become deteriorated. And the problem also in the town and also big cities, there are lack of the infrastructure of the water, supplies. Not like Singaporean, you have good water supplies. Everybody in the house is not so important to storage the water, but in the most of the town in Jakarta, most of the city in Indonesia, I mean that the water facilities is not so good as your Singaporean. And external decentralization also have a problem because it depends on the leaders, in the district as well as in the sub-district. Yeah, if the leaders is quite strong with partnership and also socialization, mobilization of the people, the dengue fever, the dengue cases will decreases very significantly. We have the lesson learned, I will tell you later on. And resistant to drug, and this is in malaria, but insecticide resistant become large now, have the problem with dengue too, and local specific diseases. So why local specific, I will talk later on. That's okay. Indonesia also follow the WHO what do you call the guideline. So we are using this integrated vector management or dengue vector control intervention based on the integrated vector management, and application of more than one, of course this is the concept, should be based on the local specific and more than one intervention. We already aware about the community participation, how sophisticated our program, how sophisticated our intervention method without community participation in the dengue control is not so successful. It's not so successful. That's our experience. How many years that we always have the problem with the community participation of community empowerment. So this problem also regulation. We just started to have the regulation in Indonesia, starting by Jakarta municipality, Jakarta province in 2008, and then this year we are also going to have the vector-borne diseases regulation for controlling all the vector-borne diseases. And although already announced by government of Jakarta in 2008, but up to now it's not so easy to enforce this regulation, the law in Jakarta. It's so complicated. It's not so easy like, okay, we have regulation and then we can use it in Jakarta. It takes time and it takes more effort to do this work. This one is the challenge. Our challenges in Indonesia because of human. Sorry. I'm sorry. Actually, I have this sore throat. Why last night I could not join you. It's very bad. Well, thank you. That nowadays, though in 2000 we have quite good medical entomologists, now become extinct. So this is challenge for our young generation to become the medical entomologist. Become extinct, become rare. I don't know why. The most of the young scientists do not want to become the medical entomologist. Let's go and work together with us to tackle our vector-borne diseases problem in Indonesia. And this is technical functional training and education. Actually, we have in university, we have the training, and also we do send our students to universities. But after they graduated, become the master or the PhD, and then they will become the boss. That is our problem also. And turnover is too fast, yeah. This is the expert one become the boss. So no one care about the vector control. And also this is partnership is easy to talk, easy to just talking in the room, but after that, okay, this is your work and this is my work. So this is also our challenge, that the why is also not so promising due to this human resources. So vector surveillance is no surveillance routine here. That's only accidental. If there is any outbreak, then the people will come to this outbreak area, then search the mosquitoes. So no more data. And this networking surveillance vector, really, I'm crying, to ask our young generation to help to solve the problem of surveillance problem in Indonesia. Then integrated program, we already applied this one, but what are the problem of the manpower, and also, of course, if we have the manpower and then we can work together, we plan together, then we can have the money or budget. It's not difficult, but it takes time to work together. Why we are going to implement the integrated vector management? We follow the WHO guidelines, so advocacy, social mobilization, and legislation. This is the important thing in dengue, controlling dengue. This do not stop for the socialization, but we have to implement this by routinely sustain activities, and we have partnership with other sector, collaboration within sector, and also the within the health sector health program itself. Sometimes, oh, this is your program, not my program. This dengue, I just taking care with the environment. Of course, environment, but the main object is dengue. So we have to work together. It's not so easy because, oh, this is my money, this is your money, that's his money. So we have to work together. Integrated approach, of course, this is integrated, that we have to use also evidence-based and research development, capacity building, and of course should has the monitoring and evaluation. Without monitoring, it's nothing also, because it's not so easy to. And this is action, our action already implemented by our government by guideline. We use guideline. We distribute until to health center, socialization with. I think that 3 years ago we have the mobilization is quite often, and also with health promotion in the television and the radio. I think we have to start again, that because this year we have seasonal fluctuation of rain. I think that this year will be have the problem, because I saw you already about Jakarta dengue cases climb up. Then strengthening partnership, with other sector, capacity building. We have work together. We have also this how to do the research, integrated program, epidemiological mapping. This is the important thing, Pak. Anybody will have, probably we have to sit together to have the proposal, set up the proposal for the mapping. Mapping, not only the mapping the problem of vector, but the problem of epidemiology of dengue. So about the virus, about the kind of cases, and how they do this, and also about clinical symptoms. That's the important thing of epidemiological mapping, including the DNA. I mean that the genetic mapping. And evidence base should be is based on the rational, effective, efficient, sustainable, acceptable, and affordable. Should be rational and effective. If not effective, if not efficient, it's not used at all. But should be RISA, that and evidence based. Thank you. Then this is program, our program already implemented in Indonesia. No, I think all Indonesians know about the terminology of 3M. Yeah, 3M. 3M mean, you know, that 3M mean menutup, coverage, menguras mean emptied, and mengubur mean purite. Use it unused containers. Improving water supplies. This is the problem, the big problem. Then biological control, such predatory fish and others, we already implemented, and our colleagues will explain about the Wolbachia, and also we have tried a lot with SIT, you know, sterile insect technique, but this not easy. Also, we have to properly for our research, because mosquitoes are not one species, but there are so many strain. Yeah, but we have to be careful about the strain of the mosquito, and also the agent. You know, we imported the agent from outside. And health education, we already implemented in Indonesia. Partnership is not so popular in the community, but easy to talk. Regulation, we already developed. Research and development. What research we are needed? You know, this research, you know, that we are going to solve the problem of cases, right? The disease transmission. So we should do the research in social knowledge, attitude, practices based on the local specific criteria. You know, that in dengue we have combi, you know, a combi based on the local specific knowledge, attitude, and practices, and also the local wisdom. And this should be working with the species bioecology. I have to go fast because I observe the time.
Thank you.
I have to observe the time. Well, this my field, you know, that my field. I already explained about insecticide resistance. We are having the data of mapping of insecticide resistance adult. I mean for the adult as well as for the larvicide. In the high endemic areas like Jakarta, Denpasar, Bali, some place in Central and Yogyakarta, they tend to be resistant to organophosphate by WHO standard as well as by the genetic. Then in some areas in Jakarta, in Jabodetabek, Jakarta and its surround, you know, tend to become resistant to the pyrethroid, mostly pyrethroid. Then in outer island, Sumatra, especially in Palembang, where is Professor Khairil Anwar, that's also resistant occur. Then also this quite important to do the vector density, you know, that this is needs surveillance. Not vector density is not worth if you do only cross-sectional, not worth at all. We have to do seasonally, so we know exactly when, where. So after we know when and where, then we can do properly for vector control. So this thing we need all, including the immunity of the herd, immunity of our people in that particular area due to dengue infection, for dengue infection. Think that this is not so easy to measure. It's not easy to measure. If you are planning to have the proposal, I support it, but kindly please do seasonally. We know exactly when the factor coming up or coming down, and correlated with the climate change as well as the other factors, environment factors. Then there's many, I think you know about that. The important thing is not this one, but the small thing is in Indonesia is quite productive. Usually the inspection only in this, the big containers, but many of us forget it. The small containers which are more productive than this container, because in this containers easy to observe, to inspect, but in this containers is not so easy. It's not so easy. We have complicated, and I think I will be finished on time. So this one, okay, but we have the program 3M is actually the source reduction. Yeah, that's many methods for the source reduction, including the plus mean we can edit some biological control agent on the community involvement. Thank you very much indeed. Oh, I'm up. Thank you.
Terima kasih. Thank you very much, Prof. Supratman.